Time now for a look at your health, and how about a look at your face? Imagine getting a facelift without having your face cut open. Now you can, and thanks to a new procedure called Ulthera. To talk about its effects and why it's different from all these other cosmetic procedures out there is dermatologist Dr. Sabrina Fabi. Thank you for being here.
Absolutely, thank you.
So, strange word, I know it has meaning behind it. What is Ulthera?
So Ulthera allows us to use ultrasound waves, just like what we're able to use when we see babies. But it allows us to treat the deep tissues of the skin, the same tissues that plastic surgeons typically use to tighten the skin in facelifts, and deliver energy to almost stimulate a gentle form of wound healing so you deliver more collagen.
Yeah, it's a strange concept that ultrasounds were used to using them as some transparency, but this somehow tightens, you say.
Right, and so we're actually able to use that to our benefit. As you can see, here's the device, and we're able to actually use it to see where we're treating, unlike a lot of the other treatments that exist.
Oh, so you actually can follow along.
And so I can follow along and actually see where I'm going to be delivering this micro-focused beams of energy, and then I can press and target and deliver that energy, and at that time create collagen stimulation.
So how long do these treatments last? 30, 60 minutes?
Yeah, it takes about an hour, and we generally, it's FDA indicated for eyebrow lift.
Okay.
And we've actually seen great results in even lifting the breast up to 2 centimeters in size when we just treat the skin of the chest.
How long do you have to do these treatments? Is there a series, a package?
That's the nice thing. Like most other skin tightening treatments, they generally take one treatment every week for 6 weeks. Here, you only do one treatment.
Really?
And treatment's not even re-indicated at least for a year.
We have some before and after pictures to kind of illustrate what you're talking about. So she used this Ulthera, and where do we see the big differences
here? And so
here?
you look at her straight on, what you'll see is, in her frontal photo, her eyes look just a little bit more open. Her cheek looks just a little bit higher. Her jawline's more defined. She doesn't have this jowling in the front. So it's not going to replace surgery, but at the same time, it's not going to leave you with scars that surgery obviously can leave you with. So you look a little bit better, you look a little bit more refreshed, but you can't tell why. And some patients really appreciate that.
Well, certainly, yeah, looking refreshed. Nobody likes to look like they actually came out of a science project, that's for sure. But tell us, are there side effects that you need to worry about?
At the most, what I've seen is that some patients experience some tenderness after treatment, but all that tells me is that we've actually done something that's going to work. And that's only to touch, not at rest.
How long has this been out there and you utilizing it?
We've been using it in our practice for now almost a year. And now we're actually applying it to other sites of the body, such as the crepiness behind the elbows, the crepiness over the knees.
Really?
Yes, because those are other areas that women just don't like to see, you know, loose skin.
Well, let's talk about pricing. Is this a big investment?
So it's definitely a lot cheaper than a facelift, but you're probably looking at about $3,000 to $4,000.
And what does a facelift run roughly?
You're probably looking at about $20,000.
Is that right?
Yes.
I had no idea.
Yes.
No wonder the stars only do it. Well, Dr. Fabi, thank you so much for being here. This is very interesting. It's called Ulthera if you're interested in learning more about it. Thank you so much for being here. And if she's using it, I mean, look at her, Lauren. Living testimony here.
Thanks, Kathleen. I'm on your side.